Dear viewers, today you will learn what changes occur in the urinary system of pregnant women. If you are interested in this topic, watch the video. I am Dr. Olena Berezovska and I welcome you to my video channel. Please support me by liking, subscribing to my channel and writing comments. You can also buy me a cup of coffee through the Buy Me Cup of Coffee page and support my channel with your generous donations. The urinary system of pregnant women works more intensively, and the level of filtration or purification of blood plasma by the kidney increases by 50% by the 13th week. Despite the significant volume of filtration, the absorption or reabsorption of primary urine also increases. Therefore, the amount of urine produced per day practically does not increase. Under the influence of progesterone, the kidney pelvis relaxed and enlarged. The size of the kidneys also changes. They increase by 1.5 centimeters. Urine tests for pregnant and non-pregnant women differ significantly owing to the increased workloads of kidneys. Pregnant women may have sugar in their urine in 70% of cases, which is considered normal. The amount of protein excreted at this time also increases and sometimes reaches 300 milligrams or more per day, which is normal. Healthy non-pregnant women can excrete up to 150 milligrams of protein per day. However, inflammatory processes in the urinary system and the number of other diseases should always be ruled out. On average, the level of protein in the urine of a pregnant woman is up to 30 milligrams per day. If this figure reaches 1-3 grams per day, other diagnostic tests should be used to exclude or diagnose very serious diseases such as preeclampsia and kidney inflammation. Ketone bodies or acetone can be found in the urine of pregnant women, which are mostly normal. Most often, acetone levels increase after a long period of fasting in the morning after sleep, as well as in the case of nausea and vomiting in pregnant women. Some doctors mistakenly believe that the presence of salt or crystals in the urine of pregnant women is a sign of a kidney stone formation or kidney infection. However, the main source of calcium salts, oxalates, and phosphates are certain food or dietary errors. The use of certain medications and significant amount of vitamin A and vitamin D can also lead to the appearance of salts. In addition to food, the increased metabolism of calcium ions in women's bodies also has an impact. Only a special type of phosphate deserves attention: triple phosphates and nitrites, which are formed during the inflammatory processes in the kidney. Urate crystals, sodium and calcium salts appear as a result of water salt metabolism disorders, which often occur during an unbalanced diet. When the sugar content in urine is elevated, microorganisms, bacteria grow intensively, and 10% of women have bacteria in their urine without signs of inflammation. Only some types of bacteria pose a danger, especially for newborns, as well as an increase of active acute inflammation of the urinary system. You will learn about bacteria in urine later in another video. Other substances may also be found in urine in amounts that are not observed in non-pregnant women. For example, the number of white blood cells and red blood cells increases, which can be mistaken for kidney inflammation. This is most often the norm during pregnancy. The level of kidney inflammation did not increase during pregnancy. Also, this was previously mistakenly believed. Therefore, urine test results should be interpreted considering pregnancy. In another video, I will tell you about the inflammatory conditions of the urinary system in pregnant women. With the onset of pregnancy, women experience a feeling of an overflowing bladder, and the urge to urinate becomes more frequent. In the first trimester, such sensations are associated with the activity of the pelvic nervous system when the uterus adapts to a new state of pregnancy. In the third trimester, frequent visits to the toilet are associated with pressure from the enlarged uterus on a bladder, which is unable to hold a large amount of urine and is emptied more often. Edema, which we will discuss in another video, is not a manifestation of urinary system problems in pregnant women. In most cases, these symptoms are normal during pregnancy. Do not forget to subscribe to my channel to learn more about health and various diseases. Click on like if you like this video and invite your friends, family and acquaintances to the video page. All the best. See you soon.